perinatal palliative care focuses on the care of families who are faced with a life-limiting fetal condition, who are making complicated medical decisions about care throughout their pregnancy and around delivery time, and of course, care for their baby after the baby is born, if that baby were to be born. So it starts early in the fetal period. For some parents, perinatal palliative care can sort of become a part of their care team as early as, like 19, 20 weeks gestation, right as they're learning about a fetal condition. Some parents start to use that resource a little bit later in pregnancy. And then there are some parents who really only meet somebody from a palliative care service after the baby is born. So that sort of spills more into peds palliative care world because we didn't really have the knowledge of that family in the fetal period. So really perinatal palliative care is more focused on the pregnant patients and how they would approach their pregnancy and the time of delivery. In some centers that maybe have a resource of perinatal palliative care, but don't have a centralized fetal health center, a referral to perinatal palliative care can come from anybody who takes care of pregnant patients. So that is social work, primary OB. Sometimes it's through the genetic counselors, perhaps. In a place like Chicago and some others where there is a centralized resources, like the fetal center, that referral comes from the fetal center directly to the perinatal palliative care team. We're very lucky to have that as, again, sort of a centralized hub for all fetal care. But before that existed here, our referrals would come from the maternal fetal medicine docs, from the obstetricians, from the perinatal bereavement social workers, actually, who sometimes meet patients before babies are born. So we kind of started on a smaller scale and then have built up through the Fetal Institute. So those referrals can come from anywhere. Families can self-refer. We've had a couple of parents who just find those resources online and then start asking their providers, like, hey, we know this exists. Can you put us in touch? So sometimes families can also self-refer. There is just a trend that families look up different types of information themselves. They have maybe better view of those outcomes of certain fetal conditions, and they seek care, where maybe in the past they were told there's just things we can't do, and people would just accept it as, well, there's just things we can't do. And now you can just Google and say, oh, Lurie is doing this trial or Cincinnati is doing this trial. And so people seek perhaps more interventions because with new technology, with new data, there are more things we can do for babies with complex fetal conditions.